Welcome to part 3, case preparation. So, things which we have to plan before placement are the dental chair position should be adjusted for optimal patient comfort and access for the operator and the assistant. Head and chest should not be lower than the feet. Local anesthesia application. Like if you're planning to place a clamp, there in that situation you can give the infiltration. For retraction, everything for the patient comfort, you can apply the gel. The general rule for limited isolation is to include one tooth posterior and two teeth anterior to the teeth being operated on. So methods, basically we have two methods, that is one step technique or also called as all-in-one technique, and second is two-step technique. As the name itself is telling, it is two-step. Now here the rubber dam clamp first is placed, in the second one rubber dam sheet is placed first. So let us go details about it. Common steps in any technique, whatever is a technique, the chair position, everything is a common steps. I would like to add few more points in the common step, like local anesthesia has already been discussed. Where we are placing the clamp, there we have to give zero point 0.5 ml of infiltration. And before the placing, you have to check the contacts, select the clamp, check the clamp stability. So selecting the clamp, as we have already done, it should have 4-point contact, okay, and it has to be well defined, and it should have the stability. Testing the retainer for the stability, we have to test. So if you feel that there is little bit lack of stability, one method is that you have to mix the impression compound and soften it and apply, or else other method is that you have to place a small amount of composite lip on the either surfaces so that it holds it. Now let us come into the all-in-one technique. As the name itself is saying, all together we are placing, like first you have to, on the template, which tooth you have to isolate, check that, make the punch, adapt your clamp. The bow should be always placed distally. Before adapting, you have to floss it, okay. Then take the help of your assistant and place into the patient mouth. Once it is placed, then adjust the frame, then relieve the wings. This is called as all-in-one technique. Let's see the video of that. As the name itself is saying, it is all-in-one technique with wingless clamp. So let us see that. In step 1, as we have to take the template, punch it, okay, of the appropriate area, and check that the bow should be always distal as shown in this video. Once it is placed, then hold with the forceps. We have the holes on the clamp, you have to engage it and hold it. Once you hold like this as shown in the picture, then transfer that to the patient mouth. Once it is transferred, yeah, like already we have done the clamp selection, okay, and see that how we have done that, is it replicating like that or not. Once it is done, see, observe this video. Now stretch the dam over the clamp slowly from the distal to the mesial side. Then come to the next tooth. Then come to the next tooth. Like that you have to stretch till the area which you want to expose, like visibility. At the curvature side, there should not be any leakage. If you feel there is a leakage, that means that your clamp selection was incorrect. So you have to definitely ensure, before doing all these things, you have to ensure that your clamp selection is proper. See this, you can see a video, it has been placed, and slowly see, we are dragging the rubber dam sheet and adapting. So in these situations, we can apply little bit of petroleum jelly or Vaseline so that the rubber dam sheet will slide on the tooth very easily. And in the to bypass the contact point, we have to send the floss. As I've already explained, discussed, that you have to follow the contours here. If you doesn't follow the contours, if you keep lot of pressure, like patient may have little bit discomfort. So if you follow the contour, it will be easy for you and the patient will be comfortable. Then that area, if you want more more clarity, more visibility, then we can add by doing this one, tugging. That is called as inversion. So this tugging of rubber dam sheet into the PDL is also called as inversion. Okay, slowly at 360 degrees all around we have to do the inversion. By this procedure we'll get more proper isolation. See here, see how it is properly isolated. Everything is clearly visible, and it is tucked all the 360 degrees. We can do this one with the plastic filling instrument with the help of that, and even with the floss. So able to see na? Yeah, it's very clear na? Yeah. Dam first method. As the name itself is saying, rubber dam sheet is placed first. So we have to take the steps are common. Take the template, make the punch, place the dam as shown in this picture. Okay, then place the clamp. Okay, once the clamp is done, then place the frame. Here let us see another video. Like this, the dam sheet has been placed first, then the clamp, and slowly apply the little bit of petroleum jelly or anything and retract. This is the case in future, I'll be telling a double clamp technique where the two clamps has been placed simultaneously. The wings has been relieved. The wings has to be relieved. If you are using the winged one clamp, then this is the way to relieve the wings. Once the wings have been relieved, then you have to floss. Okay, for additional retraction you can add another clamps. This is called as double clamp technique. Rubber dam clamp first technique. As the name itself saying, clamp is placed first. So clamp is placed, then sheet is passing. We are passing it. You can see a video over here again. So doing flossing, retraction, all are the common steps. And with the plastic filling instrument, doing inversions is also a common step. So if you are isolating one tooth, then this is the situation. If you are isolating three teeth or more, this is the situation. Here it's again a double clamp technique where one clamp distal and another clamp which is placed mesial, so that it doesn't hinder the view of which you are going to perform. This is whole quadrant isolation where more than 7 teeth are being isolated. When we are doing multiple restoration situations, this whole quadrant isolation has been used. Let's see another video. If you see, observe the clamp over here, it is very active clamp. The wings, the prongs are directed gingerly. This is called as active clamp. And you can see that we have checked the stability by placing a finger rest on the bow. Once the clamp selection has been done, and we are doing the quadrant isolation. Punch. Okay, where we are placing the clamp holder, we have to punch with the bigger hole and other things with the smaller hole. If we punch here with the bigger hole, again there is a possibility of a leak. Adapt it and transfer to the patient's mouth. Slowly drag from the top and go to the down. Place the frame and retract and adapt. For anterior multiple teeth, same thing we have to follow for the things like bleaching. We can use here same as what we have done, double bow technique, retraction. More to that, we can use this wedges. These are the wedges. Instead of a clamp, these wedges can be used. So if you do how to do these inversions, stretch the rubber dam away from the tooth and dry the mucosa with the stream of the cold air, and slowly with the plastic filling instrument try to tug it. So now we have completed the 3 regular technique. Now being a dentist, we have to decide it for which type of procedure, which type of isolation we have to do. So in nutshell, I can say that for all the endodontic, if single tooth endodontics we are doing, we can follow this endodontic technique. We have two techniques here, I'll be telling about it. If you want to do multiple restorations, like earlier which we have shown, quadrant isolation or sectional isolation method you have to use. If you want to do the bleaching, anterior like method we can use. So this is a most famous popular method in your regular day in and day out. This method of practicing is very easy. It will not take time more than 2 minutes. It is that easy. Once you practice for 5 or 6 times, you will achieve that one. This technique is called a single motion technique, and it is most efficient endodontic dam application technique through use of a winged clamps, resulting in the dam, clamp and frame being taken to the tooth to be isolated in a single motion. As the name itself, you can see sheet, frame and clamp all together in one go. In one go, we are transferring to the patient mouth. So that is called a single motion technique. The steps are here very simple. As a regular one, chair position, LA, everything we have to follow. That is done. Then take the dam sheet, take the template, punch, mark. Here I can give a one clue that while marking, make a plus sign or else draw 1, 2, 3, 4. Mark the quadrants or else we'll get confused. Then punch, then adapt the frame, then adapt the clamp. Here we have to see that the bow should be distally placed. Then transfer to the patient mouth. It's very easy. Let's see this video over here. Here we are using a winged clamp, anterior winged clamp. So in one go we went there. Okay, then after adapting, slowly we are releasing the wings. In few situations we feel in some dead spaces like here. There we can flow with the flowable composite and seal the area.